Alright, people, who's the patient and what's the case?
Her name's Honey Mustard, and she just had a myocardial infarction.
You're kidding me, right? You really expect me to believe that the patient's name is Honey Mustard? Whatever. Do you guys know anything else about Honey?
Well, I checked her lab reports and found she has dysphagia and signs of hyperglycemia.
Of course she does. She literally had a heart attack.
Her labs also mentioned that she had a low platelet count, thrombocytopenia. I also remember that she had a low red blood cell count, anemia.
Alright, you're getting a little too excited about this girl's problems. What could be causing these symptoms?
Splenomegaly. It is sometimes found that a large spleen causes this, but what can this lead to?
If you ask me, I think we're getting way too worked up about a heart attack.
I'm just gonna ignore the fact that you said that.
You guys, I really think this could be lymphoma.
We know that she had nausea and some of her myocardial cells died due to ischemia. Think, people, it could really be lymphoma. Where did she have the heart attack?
Soccer field. Some more symptoms she had were tachycardia, dyspnea, and fatigue.
I know. Again, those are the general symptoms for a heart attack. Alright, you two. I want us to go perform a surgery to obtain a biopsy of what kind of lymphoma it is.
House, we have to get to Honey's mother to sign a release form first, and she wants to talk to you anyways.
Be a doctor, they say. Never-ending joy, they say. Just come with me. You two, go check on your other patients. So, come with me.
All right, Dr. House, this is Honey's mom, Mayonnaise?
Hello.
You could call me Mayo. Does my daughter have bronchitis? Because ain't nobody got time for that.
Ma'am, no. Her diagnosis suggests to be lymphoma, and I need you to sign these release papers for if it is, which it is, malignant.
I'll sign anything just to get my girl better. Euphoria, right? I know my stuff.
Sure. Just sign these release papers, please. Thank you. Alright, let's see what we got here. Yep, this is most definitely a Hodgkin's disease. The tumor is huge. Incredible how only 1% of the population gets this neoplastic disease, and we're operating on one of them.
Yeah, but you don't have the final say. The pathologist and hemopathologist do.
We got what we needed. Let's close her up. Good work, girls.
We're going to need a CT scan from a radiologist.
Thank goodness we found it in time not to be metastasized.
That would be terrible. Good job on convincing the trypanophobic on getting anesthesia.
I really do hope her mother understands the side effects and conditions of this treatment.
13, make sure you tell Todd to let the mother know about the important information, okay?
Got it.
Alright. Alright, so...
Sorry. My baby daddy had to come because he didn't believe my girl was actually hurt.
Right, so your daughter has lymphoma, and it is cancerous. She's going to have a lymphadenectomy to get rid of it, and also chemotherapy. Does your baby daddy want to make sure he doesn't have to pay any child support or anything?
Don't get slick. But yeah, I'm cool with it. You heard that, right? You gonna stay paying for this child support and the insurance, too.
But it ain't even mine.
Also, please read over this information on the side effects of the chemotherapy. You definitely need to be informed on the risks such as cephalgia, diarrhea, nerve damage, and many
Dr.
more.
House!
What?
I think a patient's systolic pressure is too high. Where'd you put this sphygmomanometer so I could check?
In room 202. Goodbye.
Okay, T-Dog.
Jay Lee.
Hey, Quad.
You know what it is.
2K15.
Ida Baker Medical Academy.
This gross. This is for you.
GROSS.
Let's get it.
Girl Honey had a little accident. The paramedics helped her up but couldn't stand the smell of her emesis.
Too much running caused Honey to go into cardiopulmonary arrest. Dr. House doubted all of our skills.
But when they discovered swollen lymph nodes, I guess, I had a chill tumor heterogeneous who became a big deal.
So we called in Dr. Wilson, a specialist in oncology. Our big brains got together to cure Honey's cancer.
There was a problem though that caused Mayo's anger.
Honey had to have chemo, which caused immunosuppression.
Mayo apologized for overreacting. It's just that her baby daddy's got her stressing.
She got so worked up arrhythmia was the only thing progressing. The end, she was wrong. All she had was angina. Finally, she could go back to North Carolina.
Now that Honey's cured, we don't have to worry about a leukocyte count. Mayo won't have to meet a cardiologist for fast beating mounts.
Yeah.
Alright, that's what we got for
Alright.
Ida Baker Medical.
Deuces. Goodbye.